You're watching AFTV5. I am Nitra reporting. Here today, AFTV5 is out in the community of Austin, Texas to visit Central Texas Nurse Network, Inc. AFTV5 will be interviewing President Veronique Johnson of this service to tell about what she does for the community. Today we're here with Central Texas Nurse Network, Inc. with receptionist Sadie, and Sadie is going to tell us about our services here and what she does and what are the requirements for each of the classes, what they are, and we're here to learn and engage in the community.
Okay, so like you said, I work for Central Texas Nurse Network, and we have several classes. We have the Nurses Aid class that's for 2.5 weeks. It's Monday through Friday, and the requirements is you need just your ID and your social, and have criminal background check with no felonies. We have also the medication aid class. It's for 2.5 months. 2.5 months. It's Monday, Wednesday, and Friday. And the requirements: you need to be working as a nurse's aide, and you need to have your high school diploma or GED. Also, we have the phlebotomy class. That one is for 5 weeks, and it's Tuesday, Thursday, and Friday. And the requirements: you need to have your high school diploma or GED, have your immunization, your CPR, and a physical exam. Also, we have the CPR class, and we have the continuing medication aid class.
Okay. Well, we thank you for letting us interview you, Mrs. Sadie. And we're just out here today to talk about the services that Central Texas Nurse Network, Inc. provides and the requirements which you have told us about. And we're visiting President and Founder Veronique Johnson of Central Texas Nurse Network, Inc. Mrs. Veronique Johnson, how are you doing today?
I'm doing great, thank you. Welcome.
Welcome. Thank you.
Welcome to you, and I'm privileged. I feel privileged to have both of you here in my office.
Well, we are very appreciative to be here today.
Thank you very much.
I would like to ask you a couple of questions about your services, how you come about to found, and the name, and what inspired you to go into this field.
Well, I'm a registered name by profession. Will give me a little bit of background of where I came from to be here. I'm originally from Cameroon, but now I'm a Texan, full-blown Texan. My intention when I came to the United States was to go to medical school. But you know, when you come here, you're a foreign student, the fees are too high. Well, very soon I found out that you know I couldn't do that because of finances and other things. What I went on to study, my first degree in psychology, which is still in the field of helping people. But I've always been interested in disease process and helping people and taking care of people. So I then went to nursing school, which is much more closer to what I wanted to do. And teaching also my knowledge to other people was also very important to me, because I came from a background whereby people don't pay attention to the disease process. You know, if you're sick because somebody made you sick, and even in our society, you know, here teaching people about living, about themselves, about disease processes, about taking care of themselves is, you know, a lot of people lack the knowledge.
Yes.
And I've always been an avid learner, and I always like to tell people about things, share my knowledge to empower people, to help them live their life and to live healthy lives, because without health, you can't do anything. Health is very important, and I feel that everybody should be in control of their health, and it's very important. And therefore, you know, health is my calling, and then teaching people about health is also my passion. Yes. And I'm doing things that I love to do.
Yes, that sounds very exciting. So, Mrs. Johnson, tell me a little bit about the services of your clients, the success of what you have founded, and what inspired the name?
Central Texas Nurse Network. Of course, I'm in just Central Texas Nurse Network. Nurses, what we do here, we train people have to be nurses. You know, things nursing also is related to other field. You know, I don't know, nurses. I'm a nurse. Nurses come from nurturing. I like to nurture.
Yes.
And that's what it is. Network of people that want to take care of others. You know, when I'm speaking of me, that's why. But the services that we have over here, really, I started out with one program, the Nurses Aid Training Program, whereby we train people that want to enter the health care industry. This is like the ABCs. And then from here, you can propel yourself to many, many things. So have people from all walks of life, people from all professions that they always wanted to be nurses, to be in the medical field, but didn't know where to start. And this is where you can start for sure. I have some of my students that come over here very unsure of themselves, afraid, but have, from here, I have some students that have become doctors, pharmacists, or they just love to do what they're doing.
That is amazing. So it seems like they come in one way from, I guess, different walks, various of life. Some may be down or just looking for encouragement, and they're directed to you, and you have a way of nurturing, and this is a natural part of you, and they walk out joyous and happy. They walk out completing their courses.
I go to many graduations. I go to many homewarming parties and trades, and if you're a healthcare provider, you always have a job. A nurse will always have a job. The people are always going to be sick. So when you come over here, it's easy to find, for us Africans anyway, and a lot of people that understand the healthcare profession, this is where to start. You finish, you take a course of 2.5 weeks, you take your state exam, you are certified. You have the ability to work in home health, in hospital, clinics, you name it. You have somehow financial stability, and the pay ranges from $10 to even $20, and you have opportunity to do many jobs. For some people, this is it for them, and they buy their homes and they're happy. Today, I just received a present from one of my students. I'm always amazed from the thank you. You don't know what it did for me. So it's very, very rewarding, and I wish that a lot of people will know that there's still jobs out there. That with the training of 2.5 weeks, you can make up to $40,000–$50,000 a year, and you don't have to work in a nursing home. There's nothing wrong with working in a nursing home, because people think that they're going to work in a nursing home. A nurse is a nurse is a nurse. If you work in a hospital, you're going to clean people, you're going to nurture them. If you work in a nursing home, you're going to do the same thing. If you work in a clinic, the same thing. Nursing is nursing is nursing. So for those of you those that don't want to work in a nursing home, they have many opportunities to work in schools, in hospital, clinics, wherever they need a nurse, a registered nurse, they need a nurse. They need a nurse's aide.
Mrs. Johnson, I just want to tell you that I am happy to be here today, and I'm really proud of the services that you give to the community. And just by research, there are a low number of nurses for nursing homes and just to take care of the elderly or any range of age. And I believe that this is exactly what you're doing here. You're training, you're equipping people. Other people may need other things, but all in a nutshell, it is a very good thing for the community that you're bringing, and I'm just so happy that you are doing something to give back to the community.
Certainly joyful and very happy to be in this industry and to be able to empower others. I know what I'm doing. At the same time, I like to empower people. That's what I'm all about, and I'm doing that. So I'm happy with my life.
Yes,
I don't feel like I'm working. I'm here every day for long hours, but I don't feel it.
Yes,
because I'm doing what I love. And people, if there's a light in my office, yesterday I was here till 11 o'clock. Somebody came, and I have to serve them.
Yes.
They come because they know you've seen yourself how many people came.
Yes.
And this is nothing. They come. Once they get attached to us, we have an open door policy. You can come anytime, even when you finish. If you just want to come over here and sit and have a quiet time, it's okay. My students come all the time.
And you're doing just that here, and I just want to say thank you once again for bringing such an impact in the community and giving back. And I just encourage you to continue to do what you're doing.
Thank you very much, and I want you to go out there and put the word out.
Yes, we're raising awareness. You're watching AFTV5. This is Nitra Lewis reporting. President and founder Veronique Johnson.
Amen. Thank you very much.
Central Texas Nurse Network, Inc. with President and founder Veronique Johnson. Thank you for watching AFTV5.